Selamünaleyküm warahmatullahi wabarakatuh. Thank you very much. And theology. Our second lecture, I think we start talking about this very informative lecture. The second lecture of this meeting is Ictal Eeg and seizure reform. We are very, very interested in focal and debating focal abilities in our EEG. Even it's awake, sleep, prolonged, or even a few seconds or a few hours, their ictal pattern should be blunt and should be significantly identified. So, as a economic paragraph, we should know about this pattern. We focus on focal ability. So, EEG is still useful diagnostic in seizure disorders, considers often all the tool that which is diagnosed of EEG can be established. So even in our country, the EEG have a bulky, significant work for diagnosis of EEG. However, EEG finding will be determined for treatment also. So we will perform for Ictal EEG recording. We have categories for focal Ictal EEG recording. The first one is arrhythmic activity. So arrhythmic activity, whatever the direction, it is very different, I think, alpha, theta, or delta. Second pattern is paroxysmal fast. Arrhythmic activity more than 13 hertz. The third one is a suppression activity that suppress the background 10 microvolt in the amplitude. So the fourth one is repetitive, the same discharge, but it's repetitive itself. 3 or more discharges in a sequence. Arrhythmic activity like regular mixed frequencies, which is a difficult one, and obscure that involve a period of obscure the EEG activity by the muscle artifact and mix of these 6 frequencies. So the example of rhythmic activity and respiration, there is an arrhythmic activity here and the theta to delta activity over this area. So this is a focal ictal rhythm of positive frequencies. Second one is also arrhythmic activity. Here, it is an arrhythmic activity of theta delta of this area. This is an awakened call. So we didn't mention an awake or sleep or not. It is an ictal activity of the EEG. The third example is a paroxysmal fast. So in this record, we have a paroxysmal fast discharge considered most frequently 10 hertz lasting for 7 seconds. This is an ictal event. So paroxysmal fast also. This is this paroxysmal fast have 9 to 26 most frequently around 10 hertz lasting for 4 seconds. As we know, we can calculate the paroxysmal fast activity by changing the sensitivity of the paper and calculate it, and also we can calculate the time for this is the first, second, and fourth frequency. Another example is anticipation for so this is a separation of generalized flattening or word form. We have another example of flattening, which is the light separation. So separation of the background is also one type of ictal rhythm. So as we said always, in any patient with any ictal event, clinically, we should focusing on the flattening of the EEG. This type of ictal rhythm mostly missed during the EEG report. The next example is also a separate activity to generalize the flattening of the reform. Flattening, it is also an Ictal event. So we should focus thinking how if any patient have an Ictal clinical, we should focus on the flattening of the background. And this is very difficult pattern of the EEG algorithm. It is a repetitive, repetitive activity. It is very difficult because this patient have same spike, and our patient, our neurodevelopment of the patient have fixed, or if the patient have a structural abnormality, also have fixed abnormal repetitive discharge. So we should focusing on the history, and we should monitor the patient with such elliptic discharge as a video monitoring. We cannot judge only about this discharge as an Ictal event if the patient have no clinical correlation. So this activity over variety hemisphere present as bi-wave pattern. So it is a very difficult pattern and should be correlated clinically. We argue with the video monitoring. Also, this is repetitive discharge and the complex growth. This is Ictal event because this is the same elliptic discharge repetitive itself. So if there's a structural abnormality again and again, there's a structural abnormality, the repetitive discharge may be constant or more recorded during a weekend sleep. So instead of we should monitor the patient with video monitoring and correlated with the clinical events. Activity, this is an event, but also this is an very activity here that is not a focal motor seizure, and this is also to be sure that this Ictal event correlated with history of the patient. So all the area of the Ictal event have only arithmetic that is increase in amplitude and activity handling from the theta to delta to high frequencies. This is a very bad very bad idea of an Ictal event. So the Ictal event may be in limited area and maybe in fixed frequencies, maybe fixed Ictal discharge that need clinical correlation and need for further video monitoring. This is also an arithmetic activity. Really necessary. Also, because it's complex modeling with the very efficient and lots of awareness. So this is an obscure muscle identified agent. Also, this is a second data. And this is one of the most of the many examples of EEG pattern. This is generalized EEG was generalized and predominantly right-sided epithelial decrement here. It is an epithelial decrement first. They both make activity of right temporal region. This is we notice it very frequently in temporal level. So the area that the beginning of the seizure is here, not here. So the flattening of the background then of the frequencies. This is the first part of this lecture. The second part, how to write the Ictal report. So when we notice that this patient have an event, if it's Ictal or non-Ictal, so we must have this sequence, this steps in sequences. Okay. The first one, determine the clinical onset. That this needs video EEG or observation by the exam. So first symptom, as a clinical. Okay. Determine the clinical onset of the report. So we clinical onset of video or by the patient, what about come first? So when we have a special event in our video EEG monitoring, our EEG monitoring, we ask the patient, do you feel any numbness, any abnormal sensation, as an oral or something like that, visual, anything. So we must ask the patient called, patient oriented, ask the patient how it's feeling. Then, sleep or in this concept is a sleep, awake, eating time. This is about the evolution, which is the evolution of the event. So stages of the evolution. Deviation like the gastric or the oral automatism, the evolution of the compared to the leg. This must be the steps. Secondly, this is an example of clinical seizure physiology, 13-year-old female, since the age of 16 years, ictal event, slight head or left side cervical pain. So it's feel a cervical pain before the clinical onset of the seizure. Before or after the seizure, dream state and sometimes anxiety, the loss of awareness or generalization. So this is an ground flattening. In the ground flattening, patients feel what? Feel cervical pain. So this is the onset of the seizure. In one of the patient with cervical pain, we notice a flattening of the ground. Yep. Second one, this is the ictal EEG. First one, clinical. Second one, ictal EEG pattern. We will also mention the seventh ictal EEG pattern focal. So the onset of the discharge or unusual rhythm or also disappearance of the discharge, as we say, flattening of the background, full use of digital organs. For digital analysis, we can also use it as quantitative. So we describe the ictal event in 7 that I mentioned before. Determine the delay. Third one, with history, EEG. Third one, determine delay between the EEG and clinical onset. So what is first occur? The EEG. This is important for the diagnosis. This is an ictal event that can move from a retentive zone or epileptic zone or not. So we mentioned it at our record. What is first occur? The EEG changes or the ictal event. Number 4, determine the association with the drug and with the drug withdrawal. This is important for patients with physiological evaluation, and all the ictal reports should be mentioned that this patient has drug withdrawal or his drug. And this is an ictal EEG described. This ictal rhythm of the first second followed by decreasing amplitude, changing in the spatial content in F3 and G25. This is an also example of generalized fast activity 10 to 35 frontal fast activity. And as we mentioned before, this is calculated the frequency of fast activity. Also, create a table. This is a very important physiological evaluation. It's not for 1 and 2 seizure. In 24-hour seizure, we have a mechanism. So for 51 seizure, many patients with physiological evaluation have more than 1 seizure attack. So this organism, this table benefits for determining the focus that's not made. So the conclusion of the Ictal report. This is a table of the patient. The ideal patient is for table addition group of frontally focal epilepsy. So the time, the clinical, الكونتاكت, the clinical, EEG, and the duration and the drug. So if this patient have 4 times seizure, this is in very video EEG monitoring more than in short time. As we know, we have short time video EEG monitor and long time one. The long one we use a table for mention each type of seizure, maybe seizure, maybe focal or multifocal. Okay. I got it very and understand. I even guys mass EEG. Afterwards, أصعب شيء إنه نقول هذا البيشنت إكثر من it. And it is very. Oh, إكثر يعني إكثر. This patient have an إكثر with video EEG. تختلف عليه ما هذا البيشنت. فيعني it's very difficult concept. Make it a يحتاج very focus. Yes.
Most of the seizures are associated with the shape.
Yes.
Seizures are associated with shape. This shape, again, may be associated with another. هذا خلينا challenge. كنا نقدر نخوض أسباب الويل شعب عن بيانات. كنا شفنا ساعات حوالي إحدى داتا activity فيها incremental data evolving activity وفيها multitude or abnormal events very easy. But sometimes by them, which is normal. The same time, Shabbat getting a total wow. Directly the high sultan accept something as normal. That look at it, there is a query. The activity is not very clear. The same will not mean one challenge. Cloud you challenge. EEG is not conclusive. With activity to now, obviously now, again, is not conclusive. So, I have to look at the page. And the demand of the background of the activity the whole من خلال كده كان بيصير تحصل انترنشن فكره هذا غير ما مثلا هو انا عندنا او عايزين مثلا وهذا او على الكاميرا لو كنت وهذا برضه عندي الفكره اكون عارف شنو اللي اريده من ايدي طبعا ده يجي مثلا عندي سبيسيفيك فرايتي ثينجز ينقل بالنسبه وهذه مش مالي هي IGE I would exclude all these changes in the house ينمو من IGE تعمل دورة كلمة دورة مكتين challenge كلمة البحث معناتها lateral changes in EEG in IG شلون اللي يقولون هاي طبعا ليش الوضع اللي يصير شيء واخذ وقرر عليه هاي شيء تماما
صحيح ممكن تعمل المواضيع احنا فيديو ايجي مونيتور يعني مصلحة الحديث بطريقة ريسنتلي طلعنا في القانون الدراسات كانت تصير مسؤولة عن كيس معين طلع مثلا عن patients هو military وهاف سيجرز 9 سيجرز ويمكن 3-4 مرات خدت منهم انه هو ابيليبتيك ويجي لنا ويسوون فيديو ايجي ويطلعون وفيري نورمال سواء كان لون او شورت خطأ يسوون بالفيديويشن ويقطع الانتي بليتك اخر ريبورت معك 4 ريبورتات صار سيجر وطلع فعلا يعني صار سيجر وطلعت التوظيف ويعني ضرب استاذ مع عندي تفاصيل الاكتر معه بس وقتها يعني صار سيجر فهذا النورمال انتر ايجي very difficult as long time بعد عن شكليس have already noticed بالفعل يعني fix إكتر fix pattern على variable function وهي بس بتكون إيدي خدمة هيك عم شكليس أنا كم شغلة كلها صار إكتر هيك يجي ده ساعات نوقف هيك قاعد تخلص هيك ولا إن كان شرط انترفال تشكل النيرفز إنه يكون إكتر فالchallenging is very difficult. فهو الإكتر when the patient say to his or to her neurologist or clinician I have an event during the report. فلازم أن يحسس epileptic or not. فهي a very responsibility. أنا أشوف الإكتر event هي challenging and responsibility of our
إذا هو قاعد في الاستيك أخذ شهر هذا مشكلة عن الداخل ممكن شوية تحقيق واحد أو مراجعة بالإنكار البيولوجي عن ريتش مراجعة تسرع كامل عادة هذا خطأ نفس الوضع والمريض جاء غير التعليم بس
بس شغله هذا الاسلوب اعتقد the most common vector
لا مو كمان فوق النظام
الفيكتور يعني دي اسئله اكثر عمليه او خبرات فالشيء يعني نقدر نعرف هذا شيء فيكتور مثلا قبل او بعد ميتين الفيكتور اكثر اشياء تفيدنا كجايد انه هو البسل يعني الابليبتيك هاي الفيكتور اللي صارت لان احنا ديورك الفيكتور هو يصير اوبسكيور بس قبل او بعد اكثر تشينج
يعني هو اذا عندك قبل يعني بالبلد باترنز اللي نعم it is health اذا كان ورا الايفنت تساوي عاده الاوبسكيور ماسل ارتيكل EEG ايفنت يعني بها هوايه ليست من ضمن الفرونتال طبعا فمرات احنا يعني نعود البيشنت to other studies or sonography or something like that or يعني اذا كان هو عنده فوكال خاصة اللي يشوفوا بالفرونتال كيف فرونتال وبيبسي واللي عندهم مور نون فوكال أو على أندر يعني هذا core issues, or we still deprive the patient can touch the modifying the montage that's in obscure muscle article, EEG, we cannot judge about it. إلا إذا يعني نستخدم more than one report كان patient هذا العلاج كان fast كان يعني 5 times on the same record هو frontal they synchronize and repeat the same movement of hypermotor movement and كده أكيد هو حيكون كلش مهم بالنسبة لي يعني أكثر من EEG events EEG صعب التجارة الأطفال.
Dr. Mohammed Hassoun, we're working for Austrian Autograph Museum, Authority of Medical Education, as the manager of Center of Technology and Medical Equipment. In fact, I will ask out of the books. Can we use EEG for the evaluation of the autism patients?
For what?
What I mean, there are many institutes or centers, they are working for the treatment of the patient of the autism, but there is no real evaluation that they are enhanced or they are the same or they became worse. So can we use the EEG as the tool for evaluation of the brain activity?
EEG is a part of evaluation of patients with autistic behavior if there is an abnormal movement or activity, or the patient has repetitive synchronized clinical event like a gaze, like a scanning attack, or night attack. This attack may be suspected to have the patient have a seizure because the patient with autistic behavior have no the assessment of the clinical content is very difficult. So we use the EEG to capture the technical activity and even to assess the patient what is the patient with ability, what ability. So it's very helpful at that point, specifically. Just I know that there is we only know that this EEG activity abnormal 30% of autistic patients. And there is an overestimation of autism in patients with patient with speech difficulties. So we know that Huntington syndrome, as we know, have a speech regression. So I saw 3 or 5 patients with speech regression, no such autistic patient. By the EEG, we discovered that have epilepsy. So we use it to differentiate the EEG. The EEG is to differentiate that this patient have epilepsy or not. Specifically, the EEG speech-related EEG disorder.
Thank you.
بخصوص البيدياتريك EEG.